Doctors of Reddit, what is a medical question a friend has asked you that you wish they hadn't? Story 1. Wishing I had a funny or less depressing answer, but in training I ended up diagnosing and eventually confirming cancer in a hometown friend when he asked me why he sweats through his sheets every night. Cancer-free and in remission now, but also doesn't talk to me anymore. Story 2. Mom's friend showed me her MRI scans at a dinner party ahead of seeing her neurologist. The report and pics showed features consistent with multiple sclerosis. There was no way I was having that conversation with her, so I feigned stupidity and said it was outside my knowledge area and told her to discuss it with her doctor instead. My mom was mad at me for pretending to be dumb. I made it clear that under no circumstances would I be giving any ad hoc medical advice to her friends moving on. Story 3. Patient here. At one of my low points in life, I got obsessed with watching YouTube videos about people living with diseases and AIDS, and started thinking I might have AIDS too, mainly because I was tired all the time. I went to my GP and asked, "How do you know if you have AIDS?" She looked shocked for a second, like she replayed every interaction we'd ever had, then calmly said, "If you think there's a chance, let's do a test. I don't have AIDS, I have anxiety." Story 4. Friend of my then boyfriend asked me, "How do you know if you have syphilis?" Out of the blue one day, I asked him why he was wondering. He said he was just curious. Sure Bert, sure, we're all curious. But if you think you need to know if you have syphilis, the chances are high you have been engaging in syphilis-enhancing behavior and should get yourself and your downstairs area checked out. He went to the doctor. He had syphilis. Story 5. Not a doctor, but rather critical care paramedic. I had a longtime friend ask me to clarify notes she received from her boyfriend's oncology visit, just asking me to translate medical speak. It was one of the worst reports I've ever seen and I was amazed he was still alive. She was super hopeful and obviously wanting the best outcome. I gently told her that I was not the one to go over the report with her. He passed about a week later. Story 6. Got my dad's doctor friend to check my for cancer when I was 14 and found a lump. He actually said let the dog see the rabbit when I was dropping tro, and it made me laugh. So that was good. Turns out a lot of guys just have lumps on there, and also that doctors genuinely don't give a if you're their mate's son. They just see the case, which was quite interesting. His daughter had a crush on me and was friends with my sister, and all I was thinking about on the way home was, is he going to tell her about my now? Man, I was stupid. Story 7. I am not a doctor, but I am a respiratory therapist. During one of the waves of COVID, one of our lab tech's mom was admitted and was on a BiPAP with COVID. One night, while we were both working, she asked me how her mom was doing. I told her I didn't want to tell her because I was not going to lie to her. She told me she wanted to know. Everyone I have had on this high of settings on the BiPAP has died. That's not to say we aren't going to keep trying, but I want to be realistic with you. She started crying. She had just lost her grandmother a week prior, so this was pretty rough. Up until that point, apparently no one had been honest enough to tell her just how serious her mom's COVID was. Story 8. I have a story of the reverse. I asked my doctor friend about my brain MRI, had one done to investigate why my voice was so up, and being a nerd I looked at my scan when I got home. I texted the friend and asked them what is white and hazy on a brain scan, so they offered to look at the files. I sent it over. Their response was so professional and telling. I was diagnosed with brain cancer a month later. This was about 3 years ago. My cancer was deleted, and am still stable. My voice was unrelated and probably an after effect of COVID. I still think about the fact my friend probably knew what was up with my brain that day. Must have been hard. Story 9. Occasionally, less often as I and my circle age, someone will, upon finding out that I'm a surgeon, ask, "What's the worst thing you've ever seen?" The answer is, and has always been, something about which I've been trying very hard to avoid thinking, no matter what that is. The worst thing I've ever seen is very likely something that I can't remember, and deliberately so. Story 10. Nurse here. I had to interpret my mother's MRI results to her since they popped up in my chart before she could talk to her doctor. It showed metastatic brain lesions from her intraocular lymphoma, which was terminal. I've never regretted being in the medical field more than I was in that moment. Story 11. The patient my wife had a cloudy spot on a brain MRI. They told us it is likely some astrocytoma brain tumor. My best friend is a radiologist, so I talked to him about it. He explained there are 4 grades. Grade 1 is more common in kids. Grade 2 and 3 are random distributed in the population. Then he says grade 4 is for old white guys, and if you get it, you're done. We laugh because my wife is not an old white guy, so she'll probably have grade 2 or 3, which surgery and chemo can work for. About a week later we got lab results from biopsy. My wife had grade 4 glioblastoma multiforme, which the average life expectancy is something like 18 months. It was the kind that repairs itself rapidly from chemo. My wife lasted pretty near 18 months and then passed away. I'm sure my buddy regrets the flippant way he had described the possible outcomes to me, but the no bullshit talk is kinda how he and I communicate, so it didn't damage our relationship. Story 12. Friend of mine asked me to check out a weird rash he was developing. I took one look and told him he needed to stop masturbating. He asked me why and I told him, because I can't get a good look at that rash with you moving around so much. Story 13. My mother once called me because she hurt her ankle and wanted to know if it was broken or just sprained. Then she got mad at me when I said that I am a nurse and be a completely unrelated field, and see no one can differentiate a sprain from a simple fracture over the phone without an x-ray or at least an exam. Story 14. Dude I've known for 15 to 20 years tells me he has a borderline personality disorder. I have a confession to make. I have BPD. Have you heard of it? and I nearly slapped this fool across the face. Bro, you have a massive cocaine addiction. You were never suicidal before you started doing and running out of coke. Story 15. Let me start by saying this was almost 20 years ago, and I was not the medical person, but at the time I was starting classes for my CNA. At the time my grandfather was being treated for lung cancer, and I had asked one of my teachers about what metastasis in the liver meant, which was how I found out my grandfather wasn't going to beat the cancer. To his credit, when the teacher figured out why I was asking about it, he was exceedingly kind, but it was obviously really upsetting for both of us at the time. About 3 months later my grandpa passed peacefully at home with his family there. While it was really hard to hear at the time, I'm grateful for that teacher telling me the truth, so I was able to make good use of the time I had left with my grandpa. Story 16. Not a doctor or medical professional at all. I grew up in a small town where everyone's phone number started with the same 3-digit exchange. In my mid-teens the town had finally grown enough that a second phone exchange was needed. A new doctor's office ended up with a number on the new exchange that had the same last 4 digits as my family's home. We would get so many wrong numbers where the moment we would say hello the caller would launch into the most graphic description of various body parts oozing various fluids. I get people mistaking us for the doctor's office, but was baffled that they thought the doctor was answering their office phone direct and not a receptionist. Edit for autocorrect typos. Story 17. I am not a doctor. I was a HCA in AE. I do know something, but I am not a nurse or a doctor. My MIL mentioned some things to my husband which he reiterated to me, and I was like, I know 2 of those things relate to cancer, but obviously never said anything because I am not a doctor or within the cancer field. It was just some info I picked up along the way. She was told she was palliative with cancer and decided to break the news to my husband. She said I thought me would have told you, like, seriously. Story 18. Obligatory. Not a doctor, but patient in this case recovering from a failed suicide attempt number 2 after downing a full bottle of hydros mixed with beer, kidney and liver damage as a result. After telling the doctor why I did it, I saw the pain in his and the 2 nurses' eyes. I remember how he sighed heavily before talking to my family outside the room. I could only imagine what he was thinking, but props to him for being very professional. I remember my older sister asking outright to the doctor why would he try to end his life. There was a long pause and then the doctor simply and empathetically explained what I told him to her and my older brother. Story 19. Not a doctor, but a paramedic, and I think this fits alright. I had my dad and mother call me because my dad was dizzy. He was laying down and they checked his blood pressure and it was fine. I was doing the questioning I normally would and I asked him to sit up and take the blood pressure again and it was low. I asked a few more questions and finally my dad blurts out that he took Viagra and it started right after they were intimate. Turns out his new blood pressure medication, anxiety medication that he has been taking, is needed. He took that day, and he had never taken both medications on the same day. Both affect blood pressure and the combo was most likely the cause of the blood pressure issues. I was glad to help before he walked around and passed out or took them both again another time, but I could have gone my whole life without that knowledge. Story 20. Not a doctor. I'm a sonographer. I had a friend I was on a sports team with send me her images from an ultrasound she had performed on a breast mass. It was not good. Story 21. Not a DR, but a former anesthesia RN here. Worst question. My mom asking if she was going to be alright, after they found a 2-coin-size melanoma on her back. The thing was showing dendrites when she finally went to the DR. The PET scan they did a few weeks later lit up like a Christmas tree. Due to some trial meds she did make it past 2 years, which is a miracle on its own. In the end the cancer won though. Second worst. People asking what the most horrible case was I had seen in the OR. Not really something you want to talk about, or want to be reminded of. I usually answer with it's the kids that hit hardest, and it's so true. Story 22. Cook here. Nothing related to doctors or hospitals, but a coworker that had became pretty close friend at time, told me about his roommate and I told him to check as soon as possible to HPV, human papillomavirus, herpes. He did the test and BM positive, from his roommate or something before, doesn't matter, now he has HPV. He was a 60-year-old Brazilian guy, illiterate as I could see by his Facebook, and was in panic, almost crying. I'm too tired to elaborate. He confused HPV with HIV. The doctor even explained to him what HPV is, but he said after he said to me that's incurable I do not listen to anything else. I just thought that I'm gonna die. Story 23. My best friend's cousin dropped trout as soon as I got to a party and was in the kitchen. They asked, what's this rash on my? It was herpes. Full-blown herp. Story 24. Not a doctor, but I had one of the hardest talks in my life with my little cousin, who was 13 at the time. He was born with underdeveloped kidneys, and he was diagnosed with chronic kidney insufficiency as a 2-month-old baby. Doctors predicted that he could live with meds only until age of 5. He lasted until 13, and he had to start dialysis then. His mother was never supportive, she would just shut down, and the rest of the family would do her work. I will never forget when I visited him in the hospital the day they said that his only treatment now is dialysis or kidney transplant. He asked me what is dialysis and I explained it to him. I was very cautious with the words, and when I explained, he asked me does that mean that I have to do it my whole life? I didn't want to lie to him, but at the same time I didn't want to upset a 13-year-old that already has no father, crazy detached mother, and the only chance to live is when you're hooked up to a machine 3x a week. I told him that will last only until he gets a new healthy kidney, and I hope it will happen soon because children have a priority in these situations. No matter what, he has our love and support to go through that. He asked me who will give him the kidney. His mother was afraid to go into surgery, and she didn't want to do it. Others either didn't match or weren't in good health to do so. That meant that he was put on a list. I didn't have the heart to explain to him how that part goes, so I made up a story that sometimes there are people who are willing to help out other people by donating their kidneys to the ones who need them, without the dying part. I will never forget how much I cried in front of the hospital, but I never let him see me worried. He had so much trust in me because I never lied to him. I just made stories which excluded horrible parts of it. His mother never gave him that kind of support to a point. Whenever medical staff saw me there, they would always let me in, always. Even when I would just stop by to bring him clean clothes or something, they would always invite me in to see him. Doctors and nurses here know better than me how unstable parent he had. I forgot to add that he was sad and cried about not wanting to take anyone's kidney because he didn't want someone to give up his kidney in order to give him one. He was so empathetic child. Sadly, he died 3 years later due to complications with a transplant surgery. We had many hard talks during all that time, and his passing is one of the hardest losses in my life, especially because I was more like a mother to him than a cousin. Age gap between us is 13 years only. Story 25. Not a proper doctor, but I'm a retired combat medic, and I've been asked a couple of odd questions. At a Christmas party for charity that my ex used to work with, I got chatting to the charity's founder. Naturally we got round to, "Oh, your ex partner. You're not in education too? Oh cool, if you don't mind taking a look at something for me." Head slipped on the stairs a few days earlier, bit of an ache in his upper arm, wasn't sure it was worth going to a doctor. I took a look for him because why not? I'm accommodating. Reddit. His humerus was broken midway, by the feel of it clear through the bone, not displaced, but it was grinding a bit when he moved his arm. That was a fun one to explain. Story 26. Not a doctor, but a husband to one. We were eating at this fancy place and she had to stop and basically explain to a mother that her kid got cancer and she too will need an emergency surgery for her current diagnosis. 5 minutes later, she had to make another call when a relative found out that their uncle also had cancer. All three died within months. Story 27. Not my own story, but a woman I know who is a doctor almost died giving birth due to a hemorrhage. She recalls still hearing them in doctor speak talking about her stats and knowing just how close she was to dying and how she wished she didn't understand the words. Story 28. M2 medical student. So not doctor yet and haven't been through residency yet. I get asked by family and friends at least twice a month to interpret lab work, imaging reports, and diagnose symptomatology. I usually don't mind, but it always comes at the worst time when I'm cramming for an exam, in class, or busy in a healthcare setting. Recently visited my parents and a family friend was over the house, and shoved a phone with my chart results pulled up, wanted me to interpret imaging in labs before their doctor had contacted them. I held my tongue and refused. Their degenerative spine was a train wreck and had progressed to needing surgery, not my place to tell them. My atopic sister just sent me a photo of an arm rash. I probably get half a dozen such requests from her each year. It's always the same diagnosis, but she's my sister, so I don't mind. It's bad medicine to diagnose without performing a clinical exam. I hate diagnosing with just a CBC or a blurry phone picture. Better to see the patient and include a physical exam before drawing conclusions. The worst was seeing my favorite aunt develop dementia. I saw the signs about a year before diagnosis, and we suggested they see a neurologist. Aunt waited months, then went and sure enough, was diagnosed. Cousins are upset and trying all sorts of retroactive but ineffective remedies and lifestyle interventions in the hopes of reversing it. I don't have the heart to tell them that the disease is irreversible and they should be focusing on quality of life, enjoying their time together, which they are now doing, and advanced directives, care planning, etc. Rather than hopelessly slamming crossword puzzles and word games, they pepper me with questions, then decide to completely ignore the medical information I am passing along. Story 29. Not a doctor, but I'm guessing something along the lines of, can you get name of an STD from doing name of some crazy thing you wish you didn't know your friend was into? Story 30. Hi, I'm falling from an exploded plane. I can either skydive, aim towards a haystack or the sea, and I have some coins in my pocket I can throw in to break the waves before I splash down. Question is, doc, which one is going to do me less damage? Story 31. Not sure if this counts. I'm not a doctor, but I work in a hospital in a medical field, so obviously my family all think I'm an expert. My mum ended up in hospital after a series of falls. She had an MRI scan, followed by emergency surgery. The surgeon wrote up the report to my mum's family doctor, but it was in another language which my dad doesn't speak, so he forwarded it on to me. My mother had had a bowel tumor some 4 years earlier, and it had metastasized to the brain. 2 distinct tumors. The second proved inoperable. 3 months later she was dead. Story 32. When my brother graduated from medical school, all my friends sent him pictures of their testicles asking if they looked weird. I thought it was funny. He was not happy with me. One of my friends actually had a weird testicle and needed to see a dermatologist to get a mole looked at. Turned out to be nothing but still hilarious. Story 33. As a dentist, close friends, new friends, old friends always ask if I can tell if someone gave a. When I politely explain there are signs that are sometimes possible for me to see in the mouth, I can see the realization if they are also my patients. I never understood why people asked, because now every time someone wants a, they have to make sure there isn't an upcoming dental appointment. There are too many people in the world that think of me before performing the act. Story 34. I'm not a doctor, but I was going through testing and ultrasound for a large mass in my thyroid. I had my ultrasound on my birthday and watched the screen as they took images. I could see a very clear difference in the tissues. I went home and looked up thyroid cancer ultrasound images. It looked the exact same. They sent me for a needle biopsy to confirm after the ultrasound. When they finally called with the cancer news 2 weeks later, I already knew, got my thyroid removed. I'm cancer-free now for almost 4 years. Story 35: How to lose weight. I start talking in detail about the calorie deficit. But apparently people just want to hear some easy way or confirm their thoughts and still never follow the advice. Story 36: Not a doctor, just someone who studies first aid and medicine as a hobby. Had a friend hear about my interest in medicine. He was very insistent that I look at his penis, as he had left an open box cutter in his pocket and accidentally sliced it. I told him it wasn't necessary, that he just needed to not use it for a bit so it could heal, which it would do pretty quickly. Story 37: Not a doctor, but a nurse. My background is exclusively women's health and NICU. The amount of times my grandfather has asked me about his prostate has made me dread visiting him. Story 38: What's wrong with my kid? Not everyone appreciates unsolicited advice on parenting or their kids, or believes in mental health diagnoses, so if I just come out and tell them their kid has ADHD and they should absolutely get it treated now or there'll be trouble down the line, it's not always appreciated. So I mostly keep my mouth shut unless they ask. No one ever does. Story 39: I read my dad's scans and labs and figured out he had liver cancer melanoma that metastasized to the liver. The doctors kept beating around the bush and giving my mom and dad a lot of hope. I knew. He ended up dying 7 days later. Story 40: Like my hemoglobin and platelet levels were half of what they should be. My white cell counts were about 5x what they should be. Acute leukemia is a quick progressing disease. Most of my symptoms developed within a month. It's not entirely clear how long I'd have had it prior to development of symptoms. I was 27 and otherwise fit and healthy, so I'd not been to the doctors in a long time, hadn't had any blood work done to refer back to, etc. Story 41: Not an MD, PhD in the humanities. First interaction after my defense. Small talk with a clerk at a hotel right next to the university. She asked about my day, told her I'd just offended my dis and am now officially a doctor. She asked me a question about a skin condition. Story 42: I'm a practicing surgeon. In the UK it's different from being a doctor. However, one of my now former friend's patients asked me, "Are you sure you know what you are doing?" Wrong time to ask me as I'm about to remove your liver. Also, whoops, knew I forgot something, anesthetic. Story 43: You did the Lord's work, my friend. My wife was having night sweats and other signs that got explained in various ways since she was a teenager. Took nearly 10 years for her to be diagnosed with fortunately extremely slow cancer. She has been in the clear for 15 years now, but at times she genuinely thought she was going insane. Story 44: Similar, but it was a family member complaining about bloating and it was ovarian cancer, but in remission currently and still talking to me fortunately. Story 45: You just randomly answered a question I didn't even know I had. I was diagnosed with endometrial cancer last year. Probably lived with it for years. Before surgery, I would sweat puddles through the night and just be uncomfortable in general. Lived like this for a couple of years, but after surgery and recovery, no more night sweats. Story 46: Same. My aunt casually mentioned that she sweats at night. I urged her to see a doctor without specifying that I suspected cancer. She got diagnosed with non-Hodgkin lymphoma and is on chemotherapy now. I don't understand why he stopped talking to you though. Story 47: My ex had me wondering if I had something wrong with me. She would get warm and cover me up and I would melt. I would wake up after in a puddle. Finally caught her doing and got her to stop. No more night sweats. Story 48: Really, because I do too. My mother keeps saying I need to get checked for tumors. She keeps saying I might have one in my brain, but she says that for other reasons too. I sweat and urinate salt or powder. You can see white powder lines in my clothing after drying. When I urinate you can see the powder hitting the water. Urine is usually on the darker side. If I don't flush and let it sit you can see it at the bottom. I've seen some of the salt float a little at times, but it usually goes down fairly quick with the rest of the powder. People tell me to drink water, but it still happens when I cut out sodas and other high-sodium sugary drinks. Story 49: I'm shocked. My best friend sweats every night. She changes sheets and shirts nightly. Please don't mind me asking, should she check it out? I mean, I told her that's not normal, but for her it's been years and normal. Am I overreacting? Story 50: Can I ask what testing he went through to confirm the cancer? I have had all these same symptoms, and my doctor did the basic blood workup and said I'm fine, but for some reason I feel like that's not enough. Story 51: I wish more doctors were proactive. My wife is currently experiencing all this. Messed up blood work, iron stays at 5 to 7 with supplementation, and she's lost close to 40 pounds in the last few months, 146 to 112 pounds. Some days she's so fatigued she's pretty much bedridden, yet her doctor was convinced it was an ulcer. After that came back clear, she is still convinced she's bleeding somewhere. She's always bruised up and her skin complexion has changed. Hopefully we'll get answers soon, but I'm afraid whenever they decide to listen it's going to be too late. Been married 17 years and I've never known her to be at this level of exhaustion. Story 52: As someone with MS, you made the right decision. Hearing the diagnosis from a family friend would not have been good. I was diagnosed about 2 weeks before my first child was born. I was only 25. Story 53: Chiming in. You absolutely made the right call. My naive self walked out of the MRI room and asked the tech if anything was weird about it. her response was nothing that will kill you in the next 3 years. I hadn't even known anything about MS at that point, I just knew that my vision was weird, and I had pain optic neuritis. My ophthalmologist asked me some questions and sent me for the MRI. I completely forgot about it until I got a follow-up call from the ophthalmologist who referred me to the MS clinic. Story 54. Not a medical doctor, but I am a psychologist, and this is always the right move. I remember in clinicals being told a story of a woman whose son gave her a wrong diagnosis, and because she trusted her son when she got the actual diagnosis, something much more serious, she didn't believe the doctor, and ended up having serious complications that could have been prevented if she had been properly diagnosed. You never want to be in a position where you're giving people potentially life-altering information outside a clinical setting, or when there is a conflict of interest. I'm happy to talk to people about things like what they should make sure to address in their appointment, or what are some good questions to ask, or give guidance to how to advocate for themselves, but I never give even potential diagnosis. The only time I've intervened with my opinion is at a dinner party where a woman was telling me about her son who was clearly going through a manic episode with potential psychosis, and all I said was, "What you're describing sounds troubling to me. You should take him to see a mental health professional immediately." Story 55. My mom did brain scans as part of a research grant related to her non-medical studies. Apparently when I volunteered, she and her assistant saw what looked to them like some very abnormal areas. She decided not to tell me until she got a diagnosis, but later admitted that she was basically freaking me out for a solid month after sending the scans to a doctor in California. Turns out it was literally just empty gray matter. She still gets mad at me for using the phrase "I need that" like I need a hole in my head. Story 56. I'm kind of an idiot and know absolutely nothing about diagnosing conditions, so I don't really understand why you can't tell her. If you knew, why not? Story 57. I think people just assume that since you're a doctor it's okay to show certain body parts too. My wife's a retired nurse and says she's reached her lifetime limit on seeing other people's genitals. Story 58. I wonder if he took them himself and just how many he had to take before he went, "Yep, that's the one. I'm dying laughing right now. Thank you for this." Story 59. Who are all these people in this thread that have access to their imaging, but don't have the clinical interpretation of it yet? I guess I've never asked for a copy of the imaging right away. I just assumed no one would give it to me without it being analyzed first, but maybe I've been totally wrong about that. Not that it would change my course of action at all. I'm not going to ask for it if I don't have a need to do so. Story 60. It happened with a mom's friend's CT report. Obviously a pancreatic cancer, but thanks God I was still a med student, so I told him to go with her mom to the next appointment. Story 61. Every time I've ever gotten an MRI, a copy is electronically sent to my PCP, and I am given a copy on a CD. I'm told it's for my own records, and just in case my PCP didn't get the one they sent electronically, all I have to do is pop it into my computer, and ITLL pull up the images, then just print, and Viola, you have the pics. ID image. That's what some of these people are doing, or saving them to a Google Drive, and then just pulling them up on their phone from shared storage. Seems pretty likely to me that someone would get wind a doctor would be at the dinner or what have you they are going to and are antsy because they haven't gotten answers to the MRI yet and take the images with them to get a leg up. Story 62. I used to suffer from incredible levels of anxiety. I started noticing the floaters in my vision, and I started getting fixated on the idea that maybe my retina was slowly detaching. Went to the eye doctor, and no, I didn't have a detaching retina, but I did have a previously unknown condition of retinoschisis that was stabilized. Didn't have anything to do with the floaters. Even more nightmare fuel for anxious mind. If you're having high anxiety to the point of paranoia, maybe get a prescription Lexapro or similar. Changed my life. Story 63. I was so happy when my emergency room CT scan came back with an ovarian cyst because it was the first time I didn't feel stupid for letting my anxiety convince me something was wrong. Also very happy it wasn't something more serious. Story 64. Same happened to me as a teenager. I can't remember exactly why, but we had a visiting speaker when someone comes to the school and talks about some topic about HIV and AIDS. This was in the 1990s, and I'm aware that prospects for people with HIV are significantly better now. He talked about the ways you can get HIV and symptoms, etc. The thing inside your mouth that often goes with it, pneumonia, etc. I became convinced I had it. I didn't have any symptoms in common with HIV/AIDS, but felt sure it was only a matter of time and that this thing was probably already in there but dormant. I didn't do any of the behaviors that expose you to HIV, risky, drugs, etc., and hadn't had any of the experiences where you could accidentally be exposed, blood transfusions, etc. So even then I was thinking rationally, how could I have actually contracted this? But couldn't let go of the feeling either. I suffered with it without talking to anyone, who I'm sure would have set me straight immediately. It must have lasted about 6 months or so. I don't have HIV, but like the other posters, I do have lifelong GAD, which is now well controlled with SSRIs. Story 65. I was never an anxious person until I suddenly was, and it was really affecting me badly. My doctor did a nutritional checkup and found that I've become a non-absorber for vitamins and minerals. Even through my skin, my arms are covered in liver spots from being in the sun so much, and I hadn't absorbed any vitamin D through my skin. I take a handful of supplements now and am not at all anxious. TLDR, get on the vitamin and mineral bandwagon. Take D and fish oil and a multivitamin multi-mineral and an extra multi-mineral that is calcium, magnesium, zinc and D. It might fix you, or you'll have expensive PL. Story 66. To me, the translating is almost worse than asking for diagnosis because it's harder to play dumb. I'm a brand new nurse, but even during school people would ask me to translate reports and results. Sometimes I would routine blood work when they didn't know what certain things like BUN were, report after imaging of a knee, etc. Sometimes I wouldn't PET scan after cancer diagnosis, etc., but I couldn't really feign ignorance of everything. I don't know what all the words mean. I have cancer myself, and I still ask my doctor to explain results to me when I don't understand. But I remember seeing my mom's best friend's PET scan report and knowing enough to know it was really bad breast cancer that had spread to the lungs. Thankfully that was during my first semester, and she did by the eye know some of these words but not enough to translate to English. But call your oncologist immediately. Excuse. Story 67. We have to dissociate ourselves from our patients. I tell you what you need to know, I diagnose and treat. I keep friends and family separate. Unless you're really close friends or family, you're a patient and that's a separate thing altogether. Story 68. That definitely sucks. But man, if someone told me that they don't want to tell me something about my loved one because they don't want to lie to me, I'd also double down on wanting to know, like, with that phrasing, you already told me it's something terrible. Don't keep me in the dark now. Story 69. Sometimes it's just so much better to get the direct truth rather than the sugar-coated version. Not everyone needs the kid gloves. I needed to know the truth. The doctor dilly-dallied and danced around so much I had no idea it was critical until it was too late. I'll always resent them for valuing their discomfort over my chance to say goodbye. Being able to be honest with her was a real kindness.